Hi everyone, welcome to exam 3. Hope you had a great spring break. You got a little bit of a mind break, and so you can hit the second half of the course hard. So this next exam is going to be 62 questions. 20 of those questions will be in the cancer section, and the rest will be in the urology section. So a big push on the urology, just so you know. So I actually want to start with urology. I want to talk through pieces that I think you should focus on. I try not to drop big hints, but definitely trying to give you ideas where you can focus. When it comes to assessment skills, there was that huge piece on assessment. You really should know how to assess different, especially tenderness, whether it be flank tenderness or UTI tenderness. How will you assess that? Where will you assess that? So important pieces to know. When it comes to education, prevention of UTIs is a big one. Just a reminder that it is still, there could be multiple correct answers in that. What is the best answer? I know that's a really hard concept. That is how the NCLEX works. So that's the big drive, is to teach you how to take those exam questions, which I've talked about in the past. Other pieces that come to us in assessment, fluid imbalance, so watching fluid, weight loss, and especially knowing your vital signs when it comes to sepsis. So when your urinary infection turns into sepsis, usually respiratory and temp are your first to start to go up. Then tachycardia, when it's really bad, when it's blood pressure. So if you have a low blood pressure, and the question talks about, hey, which of these is the most concerning? If your blood pressure is low, think sepsis, and that's not good. Medications, really look at assessment pieces of medications like Lasix, and know your nephrotoxic medications. What should you not give if somebody's kidneys is bad, or they're going to have a procedure that has something that they're going to get that could make their kidney function worse. Okay, so really think of those nephrotoxic medication. When it comes to CKD, or chronic kidney disease, education is a big push. You'll see in a lot of questions. I think there's 3 or 4 education questions in here. Education of patients when it comes to diet, maybe medications. When it comes to urinary calculi, education on diet and fluid interventions. So if you have your notes and it talks about diet, you might want to highlight that, because think, as a nurse, if the patient says, hey, I'm fine with this, you should be able to say, no, you really shouldn't do that. So think of those education pieces when you think of diet. Safe care of fistulas is a big piece. Know your abnormals, how you find a fistula, know how you should take care of and not do things for fistulas. And then when it comes to peritoneal dialysis, know your normals and abnormals, right? So if you're looking at a patient with some kind of peritoneal dialysis or regular dialysis, what should you go, that's not right. Lab values. Everybody loves lab values. I will say there's probably 8 to 10 questions on lab values in here, especially when it comes to urinary. So know your normals, know your abnormals. Remember that urinary can affect electrolytes too. And from your last exam, think which electrolytes affect cardiac, which is your potassium and your mag. So really know those, something's off with potassium, I should think of this kind of thing. Speaking of a story of high potassium, I used to work on, actually at St. Anthony's in downtown Oklahoma City, and we would get lots of dialysis patients that, would not do their dialysis for a couple of weeks and come in. We had a patient with a potassium of like 6 and 7, which is really high, right? That's when you start thinking cardiac issues. Oh my goodness, what's happening? So there's a couple of medications you can give. There's always the big push of Kayexalate, which can cause explosive diarrhea. That's why everybody's like, ooh, Kayexalate. You can also give insulin, but insulin isn't a long-term solution for these dialysis patients. It's more of a short-term, like the patient has a acute kidney injury or something else that's causing their potassium be high, then you could give them glucose, but that's not as high as a priority as a medication for high potassium. Know your differences between upper and lower UTIs and what symptoms those have. Know your procedures and what to expect afterwards. So remember that sometimes pink and bloody tinged urine after a procedure is a good thing. We do lots of procedures here called TURPs, and we have them on continuous bladder irrigation, and we want that urine to be a nice pink bloody tinged color. You don't want big clots, and you don't want like dark red urine. Just note though, if they haven't had a procedure and they all of a sudden have blood in their urine, it can be a sign of cancer, especially in men. So something to think of. But if they've had a procedure, it could be completely normal. And then one of those interventions to know your assessments about, especially, is your intravenous pyelograms. Know how you're going to educate the patient, know what you're going to do. Just read up on that. Know the difference between and what causes all the different type of failures. There's only 1 or 2 questions that talk about the failures, but really focus on those different kinds of failures. And then remember, it's great to assess vitals prior to making any drastic changes. This comes to all nursing questions, right? So, you look at the patient and this is going on. Should I check a blood pressure before I do this? Should I check a temperature before I do this? Just because, unless it's a ABG, like, oh man, their blood, or they're not breathing, their cardiac circulation is done, I need to do CPR. Those are the emergent, like, I need to do something about that. But the way I think of it in my head is, and if anybody has done clinicals and seen people call the doctors, what is the doctor going to yell at me because I didn't check before calling him at 2 a.m.? I'm a night shift nurse, so that's the big thing, right? You want to have all your ducks in a row, and if you call and say, hey, the patient's got 10 out of 10 pain, well, did you give the prescribed medication? Well, no. Think of those things of, like, before you call the night doc, what do you need to know? I need to have a full set of vital signs. Do I need to know this piece? So before you make any drastic changes, think, what can I assess? Okay, so that's a big thing on urology. When it comes to cancer, know your lab values, such as white blood cell count, and how to treat people with low immune system. Remember that anybody with neutropenia, what's those assessments? They can't have this in their room. Remember that low-grade fevers are a big deal with neutropenic people because their body cannot fight infections. Okay, so they come in, like we have a PEDS protocol in our hospital that if a kid that's on this list that's getting chemo or is neutropenic, if they come in, they have to be seen and get antibiotics within 30 minutes because that's such a big deal for those high fevers. And not even high fevers, sometimes they can still be low grade. So I think neutropenic fever. Big issues with chemo is diet. These people don't eat a lot, and they actually need to eat more because the chemo burns so many calories in their system. So think nutrition. How can we help them eat? A lot of people get these mouth sores when they to get chemo. So how can we help them with that? Think care of patients with radiation sources, like they're getting some kind of radiation implanted. There's a big push on importance of nurses taking care of themselves. So know how to take care of yourself if you've got a patient of radiation implantation. Know radiation issues such as dry desquamation and dehydration. Think of those things. How can you help that? Know the difference between malignant and benign. There's a couple questions on that. And know the stem cell transplant process and the different processes of treating somebody with those stem cells. Think education. How am I going to educate people? And just really how to care as a nurse for these people overall with chemo and cancer. So there, I tried to help you as much as possible. I know it's a lot of broad. I can't give you specifics of what to study. But I want you to take these pieces, really focus on them, and focus on the urology, but know that cancer is still a portion of the exam. I wish you the best of luck. I know this big exam is big for a few of y'all, so really push, see how you do. I'm wishing you all the best, and I hope the best for you. If you have any questions, concerns, please feel free to email me. Give me 24 to 48 hours to answer. I'm trying to do it within 24, but things happen. So try to give me 24 to 48 hours. So best of luck. Praying for y'all. Good luck.